Well, hey, everybody, this is Robert, and welcome to Outbreak News Interviews. Now, Leishmaniasis is a protozoan parasitic disease transmitted by a sandfly that most Americans are unfamiliar with. However, my guest today says it's more common in the US than most people realize, with both locally acquired and imported cases being reported. So, what is Leishmaniasis, and what is the situation like in the US? Well, joining me today to answer these questions and more is Naomi Aronson, MD. Dr. Aronson is a professor of medicine and the director of the Infectious Diseases Division at the Uniformed Services University in Bethesda, Maryland. Dr. Aronson, welcome to the show, ma'am.
Thank you very much.
Well, let's go ahead and start out with some information about leishmaniasis for the audience. As I said in the intro, not the most common infectious disease in the U.S. Dr. Aronson, can you begin with talking a little bit about the parasite itself, its biology, and the like?
Sure, I'd be happy to. So as you say, this is a parasite that's carried and transmitted to people by the bite of a sandfly. And it's picked up and carried it to your lymph nodes and lives in your skin most commonly. And it can be a very chronic infection. It infects actually the white blood cells of your skin or some forms of your blood. And with that, it can be a very persistent infection, this parasite. It manages to use your immune system to sort of sneak under the radar and persist, maybe even lifelong without treatment. So the way it's propagated is that an uninfected sandfly will feed on a mammal, some types, different mammals, rodents, or other types are dogs and cats. And after it's infected from the animal, it may just find a human conveniently in its environment and can transmit the infection to the human. And then the human can serve as a reservoir potentially for continued cycle.
Now, like I said, the parasite is transmitted by sandflies. Where are these sandflies found? What geographically around the world?
Yeah, well, sandflies are found probably everywhere. We have them here in the United States. I live in Maryland, and we certainly have them up to that level of the United States. But sandflies are found, about 23 different species infect people that we know of. And I would say Leishmaniasis is in almost 100 countries around the world. So it's the infection is more limited than sandflies. Sandflies are very common in warmer climates where they aren't killed over the winter season.
Now, besides sandflies, the parasite can be transmitted in other ways, albeit much rarer, correct?
That's right. Yeah, there are other ways. For example, the skin form of Leishmaniasis cannot be transmitted this way, but what we call the visceral or the sort of internal form can be transmitted from an infected mother to child. You can get it by sticking yourself with a needle of the blood of someone who's infected. The visceral form can be transmitted, at least in Europe, they found between people who use intravenous drugs and share works. And you could obviously also expose yourself in the laboratory.
So globally, Dr. Aronson, how common is leishmaniasis, and what parts of the world carry the most burden?
So the World Health Organization publishes statistics every year, and they estimate the skin form, cutaneous leishmaniasis, about 1 million cases, new cases per year. And the more life-threatening internal form, visceral leishmaniasis, there's about 15,000 cases around the world each year, which is a remarkable decrease due to a very good control program going on in India, Bangladesh, and Nepal. In terms of I'm sorry, the rest of that question?
Oh, just concerning what geographical areas
Got it, yeah.
carry the most burden. Yeah.
So the more severe cases of visceral leishmaniasis, the big hot points in the world I think about in our part of the world, in the Americas, Brazil probably has the most cases. If we move over into what's so-called Old World, East Africa, and then Southeast Asia, particularly India, have the most cases. The skin form is more broadly distributed. And the World Health Organization identified most recently, about 3 years ago, the countries that had the most were Afghanistan, Brazil, Colombia, Iran, Iraq, Peru, and Syria. But it's, of course, found in lower amounts in other parts. We tend to think of it as a tropical infection, but almost the whole Mediterranean basin, for example, has low levels of cutaneous and some visceral leishmaniasis.
Now, you alluded to this a little bit earlier that leishmaniasis presents itself in different forms. Dr. Aronson, can you talk about these different forms and what are the symptoms and pathology that go along with them?
So as I mentioned, the skin form, cutaneous leishmaniasis, is responsible for over 1 million cases a year. It presents as a painless, first starts out as sort of a papule, a raised area that turns into a nodule. It often then sort of develops like a volcano and develops involution and an ulcer forms. And then in most people, it'll persist for months, maybe even a year, but it'll eventually heal on its own. The types that you can get in South America are less likely to heal very quickly on their own, but the types that you might see in Central America or in parts of the Southwest Asia theater tend to be self-healing within a year. In terms of the pathology, if you were to biopsy that skin lesion, you might be able to see the parasite inside white blood cells. It's really tiny. We call it an amastogote when it's inside the tissues. It doesn't have pus cells, but more of a chronic inflammatory infiltrate. And the amastogotes are very tiny, so sometimes they're missed on the first look of the pathology. So painless, a chronic sore, often ulcerates, is typical of cutaneous leishmaniasis. Now, if you are to acquire some species of the skin form of leishmaniasis, it can cause a kind of less common but severe infection of the mouth and nose. We call this mucosal leishmaniasis. We mostly worry about it in South America, species of leishmaniasis. And this is more difficult to diagnose and a little bit more tricky to treat. We do see it occasionally in the United States, particularly in travelers, or only in travelers. And sometimes the diagnosis is delayed just because we're not used to thinking about that as the diagnosis. And then the most severe form is visceral leishmaniasis. This is where the parasite is transmitted to you by the sandfly. It doesn't cause anything in the skin that you notice, and it goes directly into the blood, where it's carried around to your bone marrow, your spleen, your liver. And in that context, can cause a very severe infection with high fevers, great big liver and spleen. Can have very low blood counts because it's invaded your bone marrow. And I think in Western world, we'd mostly think about this being a lymphoma or a leukemia and not really consider the fact it could be visceral leishmaniasis. Visceral leishmaniasis, left untreated when it's fully active in a form that we call cala-azar, has a mortality of over 95% if it's not treated. But most people have asymptomatic visceral leishmaniasis where their immune system keeps it in control in very, very low levels, and they probably wouldn't even be aware that they're infected with it.
Yeah, and you touched on the fact that these parasitic infections can be treated. How effective is the treatment?
Well, I think the treatment's fairly good. The skin form, as I mentioned, often can heal on its own, so it's always hard to know exactly how much your treatment is accelerating that or contributing to that. But in most studies, the treatments that we use are about 70 to 80% effective with the first treatment course. Some people do have to go through multiple courses of treatment. This is for the skin form. And some of the treatments can be what I would call physical measures, where we could use either a machine that puts radiofrequency to heat the tissues, or we could use liquid nitrogen like you do in dermatology to treat it that way. Or we have some pills that we use, or for the more serious cases, we use intravenous medications. And there are several of them that we can use. For the visceral form of leishmaniasis, there's an FDA-approved regimen of a drug that we use to treat fungi in the United States. It's readily available and is very effective. Just unfortunately, you have to take it for 7 to 10 days.
Now let's go ahead and go back to the situation in the U.S. And in fact, you were the co-author of a paper a couple years ago that looked at this in particular. And Dr. Aronson, what types of leishmaniasis is seen in the U.S. and what parts of the country?
All right, so I would say you're probably asking me what types of leishmaniasis can you actually get from United States, because most of the leishmaniasis seen in the United States is in travelers.
Correct. I'm talking about local, yes.
But actually, since 1903, Texas has had low-level numbers of cases that they can't identify any travel history, and so it's felt that they're likely to have been acquired in Texas. I think there are about 80 reported cases so far. So in the state of Texas, actually, Leishmania mexicana is a species, and about 80 cases have been reported as of 2020. The state requires reporting, and so they, looking through their statistics, somewhere between 0 and 13 cases per year. So it's a low number of cases that are identified, but pretty consistently found in Texas. Then in Oklahoma, there were 2 cases that were reported, and likewise, fairly recently, in Arizona and the Tucson area, 2 cases that the species has not been defined yet. This seems to be different than Leishmania mexicana, have been reported in people who didn't have an appropriate travel history. So it looks like it's a little bit around the southern border in the Southwest.
Right, and it's all cutaneous leishmaniasis?
So, yes. I think the simple answer to that is, of the ones that have been identified, it's cutaneous leishmaniasis.
Right. And then, of course, I mean, there's multitudes more of cases associated with travel, and with the wars in the Middle East over the past couple decades, we saw this a lot in U.S. military. What kind of numbers do we see with that? And that, I imagine that's scattered throughout the country if it's military coming back.
Yeah, so the military had a big outbreak when we first went into Afghanistan and Iraq in the early 2000s. In total, with both theaters, we reported over 2,500 diagnoses of cutaneous leishmaniasis and 25 visceral leishmaniasis. So we had both in our returning deployers. In terms of other kinds of travelers, it's really hard because there's no one keeping tabs of how many cases have been reported in the United States. So I tried to sort of back into figuring this out when I wrote that paper, and I asked people about treatments, because we had relatively few treatments in the 90s and before, and it looked like there were about 50 cases being treated per year during that time period. And then there's some surveillance in a study called the Geosentinel study that suggested that over almost, I guess it was 10-year time period, we saw, we had 111 cases contributed to that study from centers around the United States. So it's not huge numbers of cases. What we saw in the military, particularly the Army, was mostly related to cases in Iraq. It was a very sharp spike, and then we were in subsequent years able to see much lower numbers of cases.
Yeah, and I would imagine too that, you know, most people that would go to their family practice doctor, they're not going to know what they're dealing with initially, right?
Yes, exactly. So thank you for giving me the opportunity to spread the word, because it is often a diagnosis that's not thought of initially.
Yeah. Now, speaking of diagnosis, is this, I guess this depends on the species, based on clinical signs, or are there laboratory tests that can be done? What's out there?
So first, let's talk about the skin form cutaneous leishmaniasis. To make that diagnosis, you have to have a sample of the tissue of the skin sore. And we have a couple of approaches to that. We can just look at it under a microscope and perhaps see the amastigote I mentioned before, the parasite in tissue. We also have a way to culture the parasite. That's a very specialty kind of test, but it gives us the ability to tell what species of parasite. So that's another way to do it. Only specialty laboratory can do that right now. Only the military's Leishmania laboratory actually offers that service. And more commonly in the recent years, people have been using molecular probes like a so-called polymerase chain reaction, a PCR test, which is probably the most sensitive test we have. And you can get that from the CDC or from other laboratories that provide Leishmania diagnostics. So you just do that on the skin tissue. It's a rapid test. It'll come back in a day or two. And it'll tell you if you have Leishmania or not. People have now been moving on to whole genome sequencing of the skin tissue as sort of the new technique. And so some centers will do it that way. You can also make the diagnosis that way. If you have the internal visceral form, there's an FDA-approved blood test called the RK39 test, Cala-Azar Detect. And that's a rapid test, kind of like what we use for a malaria dipstick. It's one for visceral leishmaniasis. And also you can do the same other tests. You can, in this case, we tend to take something like the bone marrow biopsy. You can look at it under the microscope. You can look at it with PCR. You can also culture it. For visceral leishmaniasis being a much more severe illness, it tends to require a biopsy of the tissues that are involved. So we start with bone marrow. You can also sometimes find it in the liver. In immunocompromised patients, you can sometimes just find it in the blood. And those are the tissues that we use to try to make the diagnosis.
Dr. Aronson, how has the general warming and climate change impacted leishmaniasis here in the States and elsewhere, if at all?
I think that climate change and the impact it's going to have on sandflies is starting to be better recognized, clearly, as they have some northward expansion of the sandflies. And in the United States specifically, there's some modeling done. There's a sandfly that is permissive to both the parasite that causes the skin disease and also the visceral leishmaniasis. It's already widely distributed in many states in the United States. Leishmania shannoni is found in, I think, over 30 states in the United States now. In terms of some of the, so there's the sandfly, then there's sort of the reservoir for the skin form. Most commonly for the Mexicana form we have in the United States is a wood rat, species Neotoma. And there's some modeling that shows that by 2050, we're going to be well into the North Carolina range. And by maybe 2080, the sandflies may be approaching Canada. So I think this is the projections, if climate change continues, that we'll have a much bigger part of the United States have potential vector and reservoir.
Yeah. Dr. Aronson, I guess some advice for the listening audience, how can people protect themselves either here in the US or especially during international travel?
Yeah, it's always difficult to protect yourself from vector-borne diseases. So this is a insect that tends to bite at nighttime. So you need to realize that's the time you'd be at higher risk. It's a very poor flyer. So if you have turbulence like fans and air conditioning going on, it probably won't bother you too much. It's very tiny. I always call them no-see-ums. They're that small, and you see them. Right. We have them here, in the southeast of the United States frequently. Anyway, you can also realize they're very small and they have very small mouth parts. So to bite you and to inject the parasite, if you wear clothing, if you have to be outside and you wear clothing, it's a pretty good protection. And then, of course, the parts that you don't have clothing on, you can put topical repellent, a DEET light preparation. If you're traveling, you can also treat your clothing with permethrin spray or treatments before you travel. And those are all pretty effective against sandflies.
Okay, so much like the same things you would do to prevent mosquito bites. essentially.
Yes, except that, for example, a mosquito net, which I didn't mention, is too big a mesh for sandflies. They'll sneak through that, although you can help by treating it. And also, I'm not sure, most mosquitoes around here can bite right through clothing, but for sandflies, clothing is usually enough to keep them from being able to bite you.
All right, good. Dr. Aronson, any final thoughts on this topic, or anything else you want the audience to hear?
Well, I really thank you for the opportunity to share that we do have leishmaniasis in the United States. My impression is that the amount of leishmaniasis has both been imported through people coming to the United States with it, and travelers going to countries and coming back is increasing. But I think it's also important to realize that even if you've not had a travel history and you have a consistent clinical syndrome, it should be looked at. The other thing we didn't talk about is it's a chronic, persistent infection that can live with you lifelong. Most of the time, if you don't have symptoms, no one's going to go look for it. I think one of the things we haven't talked about is we sent 2 million people to Iraq and Afghanistan that had, at least in my initial studies, 1 out of 5 soldiers that went to Iraq had evidence of asymptomatic visceral leishmaniasis. Wow. It's a pretty big number.
Yeah.
If we have a competent vector like Leishmania shannoni in the United States, and this is an infection for life, then, when you're a healthy 18-year-old, 25-year-old, probably no problem. But if it's a lifelong problem and you're not in our military system, as you grow older and have other diseases, then I hope that people will think about the fact that it sort of can hang out in your body very quietly for a long time and can reactivate when things happen to your health that might suppress the cell-mediated immune responses. Things like a lot of the drugs that we're developing, the Humira, like TNF-alpha drugs, high-dose steroids for a long period of time, transplants, and then, of course, if you had poorly controlled HIV infection, those kinds of things would make this parasite very problematic for people living in the United States, even years after they might have been infected. And I'm sure that applies also to people who've immigrated from countries where it's endemic and are now living in the U.S.
Okay. Well, like I said earlier, a couple of years ago, Dr. Aronson co-authored a study in the journal Microorganisms entitled Leishmaniasis in the United States, Emerging Issues in Our Region of Low Endemicity. And I'll link to it in the show notes. If you want to take a look at it and check it out, it's good. It's a good read and it's very informative. And I want to thank you, Dr. Naomi Aronson, for sharing your time and expertise with us today. Thank you, ma'am.
You're most welcome.